Healthwatch is presented by UMass Memorial Healthcare. Here, caring for you.
What is atrial fibrillation?
Atrial fibrillation is the most common abnormal heart rhythm that we deal with in cardiology. And basically what it means is that the top part of the heart is beating chaotically and irregularly, and it tries to drive the bottom part of your heart, where the real heart rate comes from, to beat also fast and irregularly.
Tell me what role blood thinners play in treating AFib.
When somebody has atrial fibrillation and they're at risk for developing blood clots, we often thin their blood. And the most common method of doing that is with medications.
How does a left atrial appendage closed device implant work?
When people have AFib, there's actually a very specific section of the top part of the heart where blood clots form. Left atrial appendage occlusion devices have been developed, and these are devices that are percutaneously, meaning minimally invasively, taken from the groin up to the heart and put over into this appendage, and they basically seal it off so that blood can't flow in and out of it, thereby alleviating the need for long-term blood thinning medication. Currently in this country, there's only one left atrial appendage occlusion device that is FDA approved, and that is the device called the Watchman device. It's preloaded into a catheter, and it's inserted from the groin through a catheter, minimally invasive, and we put it up to the left atrium, and you basically put it into the left atrium and you unsheath it, meaning you just kind of pull back. Once we can prove that it's in a nice safe position, we actually let go of the device, and that's it. And then over time, what happens is that the lining of the heart actually grows and seals over the device so that blood can't flow around it or through it. And what's been found is that the Watchman device is as good as Coumadin or warfarin in stroke prevention without all the bleeding risk that's associated with Coumadin or warfarin.